We know this bill will not fix the problems in the American healthcare system. It will not lower healthcare costs. It will not lower insurance premiums. It will still leave 25 million people uninsured. What this bill will do is spend $2.5 trillion and guarantee a much bigger role for the government in dictating how health care will be provided in this country. Some of my Democratic colleagues have attempted to argue that this bill doesn't cut the Medicare program. They further said that such cuts are justified and will not harm the program. They've also argued that no beneficiaries will lose their benefit, their guaranteed benefits, and they're very careful on that, and I understand why they're very careful on that, because there are other benefits that are being cut that will be considered by those people who lose that benefit to be a guaranteed benefit. Unfortunately, all of those statements are false. It does not matter how many times my colleagues repeat these claims, they do not become any more accurate. This bill cuts $464 billion from the Medicare program. It slashes payments to hospitals, nursing homes, home health agencies, and hospices. These are cuts to the Medicare program. Some of my Democratic colleagues have accused us of trying to scare Medicare beneficiaries. If seniors are scared by our statements, they should be terrified by what the administration has to say about the Democrats' health reform bill. The administration's own chief actuary, Richard Foster, recently wrote that the steep Medicare cuts in the House-passed health reform bill would make it difficult for many providers to remain profitable and cause them to end their participation in Medicare. He went on to note that this could jeopardize Medicare's beneficiaries' access to care. Now, the chairman of the Finance Committee has repeatedly said that this bill will not cut or reduce any guaranteed Medicare benefit. That statement seems to ignore what this bill will do to providers. If a Medicare patient cannot get into a nursing home, they don't have nursing home benefits. If they can't find a home health aide willing to take Medicare patients, they don't have health home benefits. Now, the promise for coverage, which you can't get a doctor to see you, is not health care. You don't have benefits if you can't get a provider to treat you, and unfortunately, that's exactly what this bill will do. Some of my Democratic colleagues have also attempted to justify the Medicare cuts in the Reid bill by arguing that many of the trade associations representing health care providers have endorsed this bill. Now, finally, many provider groups have been reluctant to speak out against this bill because they've received threats from the White House and congressional Democrats. Nursing homes, home health agencies, and hospice providers have all reportedly been threatened with further cuts if they speak out against the bill. Is that freedom of speech, or is it just bad ethics? They've reportedly been told that any public statements of opposition to the Reid bill will lead to even more severe cuts. These providers have had to make the choice to silently accept devastating cuts rather than oppose them and risk being utterly destroyed.